Good afternoon, everyone. Thank you for joining today's training on BHA Care Coordination Programs. This training is going to focus on subsequent M1 holds in the emergency departments, terminated certifications, and incompetent to proceed to short-term civil certifications. My name is Callie Lickness, and I am a Care Coordination Training Specialist. We will cover essential protocols, statutes, and processes designed to support care coordination and ensure smooth transitions for individuals in these systems. Let's go ahead and start with looking at our agenda. Here's a brief overview of what we will discuss today. So we're going to be reviewing the emergency department subsequent M1 holds, terminated certifications, and then we'll be ending with incompetent to proceed to short-term civil certification. So first off, we're going to start with the Care Coordination Emergency Department Assistance Program. As of July 1st, 2024, the Care Coordination Emergency Department Assistance Program is live. This program assists emergency departments in placing individuals on subsequent mental health holds. Under Colorado Revised Statute 2765-1067A, emergency departments must notify the BHA when appropriate placement cannot be located. The BHA will provide support in finding either inpatient or outpatient placement, depending on clinical needs. This program applies to general hospitals with emergency departments and freestanding emergency departments across Colorado. So what does this mean? The purpose of this program is to streamline the process of securing placement for individuals who remain on mental health holds. We aim to reduce barriers to care and ensure that facilities can access the necessary supports to place individuals in clinically appropriate settings. This training will provide you with detailed steps and guidance. Apologies. Information that's needed. To ensure efficiency, emergency departments should contact the BHA no later than 24 hours before the initial hold expires. The following information must be provided: the individual's name and date of birth, any psychotropic medications that are being prescribed, facilities that have maybe already been contacted, efforts made to meet language, identity, accessibility, and/or cultural preferences, court contact information for consecutive holds, and an attorney's information if applicable. Updates must be submitted for each subsequent hold using the provider form or the live link. Overview of steps. The process for subsequent mental health holds involves 4 key steps. First, the emergency department assesses the need for a subsequent M1 hold. Second, the emergency department contacts the BHA via phone, email, or the live link. Third, a BHA care navigator assists with locating an appropriate placement. And 4, once placement is secured, the emergency department sends completed admissions packets to the accepting facility. To recap, care navigators are available daily from 8 a.m. to 8 p.m., 365 days a year. Please contact the BHA 24 hours prior to the initial hold expiring if placement is still needed. Use the provided forms or the live link to update BHA. And remember that it is the emergency department's responsibility to send admission packets to the identified facility after placement. So to review a little bit over notices of subsequent emergency mental health holds, when placing a subsequent hold, an M1.1 form must be filed with the court. The subsequent M.1 form holds can be placed if placement has not been found for the individual during their initial M1 hold, so that initial 72-hour hold, if the individual comes to the emergency room on a mental health hold and is still meeting that criteria, which would be imminent danger to self, imminent danger to others, or gravely disabled, if the individual will not remain voluntarily in treatment or will not seek the treatment voluntarily, and also if the individual is medically stable. The The M1.1 form must be completed by a qualified professional and submitted to the courts. BHA must also be notified to provide placement support. Evaluations can be completed by a professional person, which includes a licensed APRN with training in psychiatric nursing, or a licensed PA, an LCSW, an LPC, or an LMFT who has 2 years experience of behavioral health, safety, and risk assessments working in the healthcare setting. When the M1.1 is sent to the court shall appoint an attorney. BHA must also be notified of the subsequent emergency mental health hold. And then here is just an overview of the M1.1 form. Here's the contact information for the BHA Care Coordination Team and the care navigators who assist with this program. They can be reached by phone at 720-947-5076 or by email at bha_carecoordination@state.co.us. Next, we will discuss terminated certifications. As of July 1st, 2024, BHA expanded its responsibility under House Bill 22-1256. Providers must report terminated, expiring, or transferring civil certifications and include a continued care plan. In cases where support is needed, BHA will coordinate care to ensure smooth transitions for individuals into voluntary treatment with adequate community support. Facilities should notify the BHA at least 15 days before terminating, transferring, or allowing certifications to expire, or as soon as possible. Notifications can be submitted via an online form which will track certifications and their care plan. If additional assistance is requested, the BHA will schedule a continued care meeting to address gaps and ensure stability. If a facility who is providing care for a person on an involuntary short-term, long-term, inpatient, or outpatient civil certification determines that the certification will be terminated, transferred, or allowed to expire, the facility will notify BHA as soon as the determination is made or at least 15 days prior to the change in status. BHA will provide an online form facilities can use to report terminated certifications. Terminated certifications does encompass transferring or expiring. This live link to Qualtrics is a database which will track the expiring, transferring, or terminated certifications and those continued care plans. Facilities may also use the notification form to identify that they require assistance with a person they have identified as either being in need of ongoing treatment and services, or which they have not been able to either provide or refer the person out. If assistance is requested, BHA care coordinators will reach out to the facility to schedule a continued care meeting. BHA care coordinators will review submitted notifications daily to identify certified persons who may not have sufficient ongoing care plans to maintain stability after the certification is no longer in place. BHA care coordinators will reach out to the facilities if insufficient support is identified in the initial review of the notification and request for more information or documentation from the submitting facility and/or will request a continued care meeting. If a continued care meeting is required by BHA or a facility that requires assistance, they will then be asked to arrange the ongoing care and create, If the continued care meeting is requested by BHA or a facility that requests assistance to arrange ongoing care, facilities will be expected to make members of the care team available so that the individual who is certified can be discussed and a continued care plan be created. If the BHA and the facility determine that additional assistance is needed, they may provide care coordination services. And here are the reporting links. So there is a live link on the BHA website under the provider resources page. On that page, there is also going to be the tab for the terminating, expiring, or transferring of civil certifications, as well as reporting form instructions. This will then help to also walk you through what is necessary. So we'll go ahead and review now. Providers will notify BHA within 15 days of terminating, transferring, or an expiring certification, or as soon as that determination is made. Report by filling out the live link and identifying the continued care plan. Providers can also just request assistance when completing this notification. So if they understand that they maybe do not have certain resources available for the individual whose certification is either transferring, expiring, or terminating, they can request for this assistance. Continued care plans will be assessed to identify people who appear to have inadequate supports and will receive care coordination. You will also be able to ask for support from BHA Care Coordination Team for any terminated certification, and that can just be done by requesting assistance. And you may email BHA_civil certifications at state.co.us. Next, we're going to be reviewing incompetent to proceed to a short-term civil certification. This will otherwise be known as ITP to STC. And this also goes over BHA's portion and what they are able to do along with this program. All right, so we'll review the processes for individuals adjudicated as incompetent to proceed and referred to a short-term certification. Under House Bill 23-1138, the BHA Care Coordination Team will assist with placement and the continued care planning for individuals in this pathway. The goal is to stabilize individuals so they can engage voluntarily in treatment or regain competency to participate in the legal proceedings. Again, a major goal for this is to facilitate a person's return to voluntary treatment with proper supports as soon as possible, preventing the person from cycling through the involuntary treatment or criminal pathway due to lack of support. This timeline helps to show the court process as well as outline the necessary documents and M forms needed to request care coordination assistance with incompetent to proceed to short-term civil certification. So initially, this usually will start in the criminal court where an individual is found incompetent to proceed, following a request from the district attorney or professional person and considering any objections from the defendant. The court hearing the criminal matter orders the requesting party to initiate a petition for short-term certification in a court with authority using the supportive forms and the M3.5B. Once those are done, the orders are filed. Petition is filed by the district attorney or professional person to the civil court using the M21 form, and requests for BHA care coordination is made to seek bed placement using the M3.5A. Petition must include information outlined in 2765 108.52, and that really is specific for the competency mental health evaluation, that they're identifying whether or not this person is in need of inpatient or outpatient short-term certification. M3.5A must be sent with accompanying information and the M3.5B. This will then happen under the court's review. So upon the filing of the petition and affording the chance to contest the petition, the court may grant or deny the certification. If the court certifies a person for short-term treatment, it is not for more than 3 months using the M8.4 order. BHA care coordination will assist in finding placement and work with the court to ensure treatment of the incompetent to proceed to short-term certification individual. Once placement is found, BHA will notify the court of the jurisdiction to include placement on the M8.4. Should be noted that while the BHA care coordination step is not required by statute, BHA's involvement will benefit the individual and courts in ensuring placement is secured and the individual receives treatment. And then I went ahead here and created an order of operations for the supportive forms and the M forms. So the initial form that is needed is the request to initiate petition for short-term certification. And this can be found under the supportive form tabs on the M form folder. The next form that is needed is the M3.5B, which is the order to initiate the petition. Then you'll need the M21, which is the petition for incompetent to proceed to short-term certification. Then that moves to the M3.5A, which is the bed placement request form. This form is very important as this form also includes protected health information. So it allows for the agencies a part of this process to be able to communicate with one another. And then lastly, it'll be the M8.4, which is the certification order. And this is the form that's going to be used to identify the facility that will be accepting the individual on the short-term certification. And we'll kind of go into a little bit more detail about these in the upcoming slide. This process involves several critical steps and forms, including the M3.5A for bed placement request and the M3.5B order to initiate the petition. The BHA care coordinators worked with courts, providers, and facilities to ensure proper placements and care. It is important to note that the M3.5A was created to give guidance to the petitioner about the clinical information needed for a facility to accept a short-term certification, and that the M3.5B was created to allow for protected health information to be shared within the agencies that are a part of this process. You will see here that all correspondence with the BHA care coordination team is done via encrypted email or fax to BHA_civil certifications at state.co.us. And then here's just a brief overview. This is what the M3.5A looks like. That's the request for care coordination, and the M3.5B, which is the order to initiate petition for certification for short-term treatment and for disclosure of protected health information. All right, so now on to BHA care coordinators process. The referral information, so coming from the M3.5A and the supporting documentation, will be sent to assessment and referral teams or their intake teams, and BHA care coordinators will work with the court representative, professional persons, and attorneys to provide additional information when necessary. BHA will continue to seek placement until an appropriate placement is found. BHA will send notifications to the jail and the court informing them of details of the placement so that transportation can be arranged. Once completed, the M8.4 order for short-term treatment should be sent via encrypted email or fax to, again, BHA_civil certifications at state.co.us. Once placement is found, the treatment facility will hold treatment custody of the individual as per 2765-109, and they will continue the certification process. The M8.4 order for short-term treatment. Once a facility has been identified to provide treatment as outlined in the evaluation, BHA care coordinators will send notification to the jail and the court informing them of the details of the placement so that the admissions packet can be completed and transportation arranged. Once completed, the M8.4 order for short-term treatment should be sent via encrypted email or fax to BHA_civil certifications at state.co.us. Once a short-term certification is ordered for a person adjudicated as ITP and the facility has accepted it as providing treatment for that person, the facility will alert BHA care coordinators by secure email and notify them of all of the following circumstances within the indicated timeframes. So they'll immediately notify BHA care coordination if there is a plan to discharge a client from a facility, either because a lower level of care is appropriate or for any other reason. If the person is AWOL, if a certified person is refusing care and is decompensating in conformity with 2765-111-3. They'll notify within 21 days if the certified person has not engaged in inpatient treatment and outpatient services are not utilized in conformity with 16-8.5-111-2B. And then ideally, they'll let us know 15 days in advance of an expiration date. This expands to terminated or transferring certifications so that continued care planning can occur. And then here is the M8.4, and as you'll note on the second page there is whether the identified facility needs to be named. Expectations for providers. Providers play a key role in this process by notifying BHA of changes in certification status and participating in continued care meetings. Notifications must include termination dates, discharge plans, and any anticipated transitions to lower levels of care. So you'll see on here that they need to be notified. They need to be notifying BHA care coordinators when someone's being discharged from an inpatient facility to a lower level of care. They're being transferred from one outpatient facility to another. If the care team determines that the person is stable enough to participate in their own voluntary outpatient care, and the certification is going to be transferred or allowed to expire or terminated for any reason. So the big piece around this is really wanting to make sure that those continued care plans are in place and that the individual who is going to be either stepping down in levels of care or transitioning what services they're being receiving has all necessary and appropriate adequate supports in place. It is also good to note that the courts will be notified via the M10 form within 5 days of the release. So that's with terminating or expiring certifications. And this notification will come to the clerk of the court. I want to say thank you for staying on and following through in this presentation. Please feel free to reach out to BHA Care Coordination Team with any questions. The care navigators can be reached by phone at 720-947-5076 or by email at bha_care_coordination@state.co.us. And the care coordinators can be reached at bha_civil certifications@state.co.us. We thank you for your time today and have a great rest of your afternoon.